Oftentimes when people present with groin pain, it's unclear where this pain is coming from. It can be coming from the hip, it can be coming from the area where we describe as a core muscle or sports hernia injury, or it can be coming from another source.
It's a complex diagnosis. It can be very life-altering. It really prevents people from living the kind of lifestyle that they want.
I'm an orthopedic surgeon. I specialize in sports medicine surgery, but particularly around the hip.
As a general surgeon, I take care of a lot of different types of problems.
We thought it would be great for patients to have a singular home to be able to see both of us. Together, we developed this combined sports hernia clinic.
While I was marathon training, I started getting tightness throughout my hips and core, and eventually I got to the point where my hips would lock up and catch and give out. It was one injury that spanned two specialties, so it took Dr. Mauro and Dr. Zukerbraun collaborating together to treat the injury and get me back to feeling whole again.
This clinic has been built in conjunction with family medicine, sports-based practice physicians, physical medicine and rehabilitation, as well as physical therapists.
You can get through a sports hernia without having to have surgery. So really making sure we're bridging that gap and getting therapy started at the right point and really trying to build up their strength as we go and mechanics of the whole pelvic region. And so if that's a time where the patient really just isn't tolerating the progression with therapy, we can get them back in to meet with the surgeons to look for further options.
There are times where patients will have a combined surgery where under one anesthetic, I'll do the surgery on the hip, correcting their labral tear or their hip impingement, and then Dr. Zukerbraun will repair their core muscles. It allows us to then have one rehab period, one anesthetic. We can see them both together in the postoperative period and manage their care after surgery.
After my surgery, I was stronger, faster, had a better range of motion, and most importantly, I didn't have chronic pain in my hip.
Part of the art of doing this is collaborating in real time, sitting with the patient, understanding their needs and ability to rehab, ability to take on a surgical procedure like this.
If we can deliver this kind of care in a patient-centered manner, that's a win into itself. It's so satisfying. The opportunity to make people feel better and see someone say, I feel like I got my life back.